Good evening, doctors. Welcome again. Today we are going to discuss here about radiology MCQs of INI-CET exam 20th November 2020 paper, memory based. Okay. On 5th post-operative day following lap cholecystectomy, a patient presented with pain abdomen on USG 5 into 5 centimeter collection in Morrison pouch, or we can say the fossa where we remove the gallbladder. A possibility of biliary leak suspected. What is the most sensitive investigation to detect? ERCP, HIDA scan, MRCP, CECT. What happened, guys? In practical cases in live patient, we do firstly sonography also to detect there is a leakage. So in this condition the best option should be HIDA scan. If the HIDA scan facility is available, go for HIDA scan. Then we can do MRCP, and after that the standard treatment we go for ERCP to close the biliary leak or put the stent. So the first best investigation sensitive here is HIDA scan. So go with HIDA scan. Okay. Now, a young patient with intermittent pain in the calf is presented to surgery OPD. On examination, a painful ulcer seen at the tip of great toe surrounded by black color skin. Best initial investigation in this case would be, so for this case the best investigation, initial investigation they are asking. Initially we always like to perform Doppler ultrasonography, so we have to initially we need to do duplex scan. If they ask the best investigation or most sensitive, we need to go for CT angiography. Okay, or digital subtraction angiography. So here initial investigation is duplex scan, Doppler ultrasonography. Okay. Now, which of the following investigation can be used in osteoporosis multiple completions? So in osteoporosis we use DEXA scan, but bone scan has no role. We use quantitative LT, and we need to go for chemical analysis. For example, we need to know the level of serum calcium, serum uric acid, serum phosphate, serum magnesium, parathyroid hormones, etc. we need to perform. So the best answer here is C. It's ACD. So all three are best. Hope it's clear. Now move on next. Sorry. Yeah. 7-year child presented with lymphadenopathy, skin lesion, and following skull latex lesion. Latex lesion radiograph. Which of the following drug commonly used in this scenario? The image-based MCQ is there. Image of a skull, and there is latex lesions. So the following drug we used, the drug we used here is vincrestine. Okay. Now, 40-year-old patient with history of peptic ulcer disease was having abdominal pain since many days. It get worse since last 2 hours. A radiograph was performed. An image of chest X-ray were given. In this we see peritonitis due to perforation of peptic ulcer. Peritonitis happen. What is to be done in this patient? So the best CT scan no need, because we have X-ray and peritonitis is visible, that's why no use. And USG is not, we are going to observe here. We have to do the best step is IV fluid and emergency laparotomy you have to perform, or we can use observation also. So both are correct, but best one is IV fluids plus emergency laparotomy. Okay. 30-year-old patient with progressive difficulty in swallowing for both solids and liquids. For 8 months, barium swallow was done and shown below. The image is nearly around achalasia. BMI is 18.5. because in young patient there is a less chance of cancer. So achalasia image and the esophageal carcinoma image looking nearly same, but this is a young. So for achalasia, the gold standard investigation is manometry, but option is uh, upper GI endoscopy, upper gastrointestinal endoscopy plus manometry. We have to choose. If the age is 80 years, or this question is like a cancer, so we need to go for upper GI endoscopy plus CECT, not with PAT. Okay, so answer is A here. Now, a young male met with an RTA, road traffic accident, brought to the casualty with GCS score E2, V2, M3. I hope it's clear. Watch my GCS scoring lecture. He has features of raised ICT. Remember, RTA triad, RTA, raised ICT, intracranial tension, and no significant change were seen on non-contrast CT. So CT is absolutely fine. Tape spinal imaging was also normal. Is spinal imaging normal? NCCT normal? And what could be the probable diagnosis? So this is a triad direct question. You have to answer diffuse axonal injury. No need to think other options here now. Okay. 25-year-old patient come to the emergency after RTA, road traffic accident. He was able to speak but not in sentences. On auscultation, hyperresonant note is seen on right side chest. X-ray was given below. Typical tension pneumothorax image is visible in chest X-ray. What is the most appropriate management of this patient? Guys, for this patient, the best management should be you have to put a large bore needle in a fifth intercostal space and the ICD in fifth intercostal space. So this one is a perfect and best answer. And X-ray image of bamboo spine were given. Question they ask. So in bamboo spine, if you see the image, you have to answer that is ankylosing spondylitis. Okay. In E-fast, which of the following part of body is included apart from abdomen? In fast, we include 4 parts of abdomen, but in E-fast, we include thoracic cavity. So direct MCQ you have to answer. Now image of bronchiectasis, I'm going to make individual separate video about all image based, where I will explain you how is it cystic fibrosis, bronchiectasis, etc. Okay. And 12th they ask best image view for frontal sinus. I already explained in PNS my lecture, that is Caldwell's view. For maxillary sinus, the best view is Waters view. Reverse the M, it looks like W. So this is Waters view, and for frontal sinus best view is Caldwell's view. So guys, if you like my videos, put like on it. If somebody is new on my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.